Wisdom teeth or third molars are the last teeth to develop and erupt in your mouth. If the wisdom teeth are in proper position, are pain-free, with no cavities, no gum problems, and are disease-free, then patients can keep them and use them for function. In such a scenario, I recommend that retained and functioning wisdom teeth be evaluated on an annual basis by me or a board-certified oral and maxillofacial surgeon. Patients need to know that oral and maxillofacial surgeons are the recognized experts in the management of third molars or wisdom teeth. If the third molar or a wisdom tooth fails to erupt or break through the gums completely in an upright functional position, we call it an impacted wisdom tooth. An impacted wisdom tooth can get infected or can damage the adjacent teeth by creating an area which is difficult to maintain by routine brushing and flossing, thereby causing gum disease, bone loss, or cavities. Impacted wisdom teeth can also lead to formation of cysts or tumors, and all this can happen over a long period of time without actually having pain. By the time there is pain or patients notice there is something wrong, it may be too late to prevent the problem. Ideally, I recommend removal of third molars or wisdom tooth when the patient is between 16 to 21 years of age, or when the roots are not developed completely. The recovery in this age group is fairly quick, and the complications such as nerve damage or damage to adjacent structures are very low. Surgery can be performed under local anesthesia or office-based general anesthesia. My team at Shoreline Orofacial Surgery and Dental Implants have an in-depth knowledge and expertise in office-based general anesthesia, which can dramatically improve the overall surgical experience for our patients. Typical surgery involving removal of wisdom teeth can take between 45 to 60 minutes, followed by a short period of recovery from the general anesthesia. Patients are then discharged in the care of their family or friends who drive them home. Recovery from wisdom teeth surgery involves 2 to 3 days of pain discomfort, which is well controlled with medications, some post-surgical swelling, in some cases mild bruising, and a short period involving limitation in mouth opening. We recommend that our patients start on a soft diet for the first 2 or 3 days and then slowly advance towards their regular food as the conditions improve. We strongly recommend to maintain the surgical wounds by rinsing and gently brushing around the area. Any retained food can become a source of infection, can cause wound to break down, and can lead to increased chances of dry socket. Patients can apply ice on the outside of their face for up to 48 hours from surgery, and this will help in reducing pain and post-surgical swelling. Bleeding or oozing after the surgery is well controlled by placing clean gauze or moist tea bags over the wound and biting down with good pressure. Holding this pressure for 40 minutes usually will considerably slow and stop the ooze. Applying ice to the face also helps in controlling the ooze. Wisdom teeth can develop close to the sinuses and nerves and can sometimes lead to opening in the sinuses or tingling or numb feeling over the lower lip, chin, or tongue. Such risks are, however, very low, and symptoms of sinus drainage or tingling is usually temporary. The risk of permanent numbness is less than 1% in young patients and can get higher in older adults. Patients are typically prescribed oral antibiotic and an antibacterial rinse along with pain medications. Take these medications as prescribed. If the surgery is performed under general anesthesia, patients should remain empty stomach and should not eat or drink for 8 hours before their surgery. You may take prescription medications in that 8-hour window with a small sip of water. Patients should always be accompanied by a family member or friends who will drive them home after the surgery.